A very good evening to all the viewers. I am Dr. Shweta Ghadge from USV and I welcome you all to today's IGCP chat show on the effect of probiotics on small intestinal bacterial overgrowth. Due to PPI overuse, PPIs have induced strong acid suppression in the stomach and are used to treat upper gastrointestinal ulcerative lesions. However, recent studies state that PPI administration provokes dysbiosis of small intestinal bacterial flora, leading to multiple gastric disturbances and affecting the quality of life of patients. To share his opinion on PPI-induced Sibo and role of probiotics, I welcome Dr. C.R. Rawat sir, a very well-known and reputed cardiologist from Agra. Welcome, sir, and thank you so much for joining us today. Sir, starting with the topic of discussion here, what do you believe, sir? Is there a PPI overuse that is going on, and also does it have an impact on the gut microbiota?
First of all, I'd thank USV and I'd also thank Dr. Shweta for allowing me to speak on this topic. One of the discrepancy of this topic is I'm a cardiologist and I'm talking on gastroenterology. But I tell you one thing, the choice is very good because a lot of gastric problems they pose as cardiac problems, and I get a lot of patients who complain of chest burn, retrosternal burning, bloating of the abdomen, and thereby pressure over the chest, and they come to me. And one of the problems which aggravate this is PPI overuse, as Dr. Shweta has very rightly pointed out. And today we will be talking about this. What is the impact of PPI overuse and how much it is being overused? Uh, there is a trend in the country when everywhere, even in foreign places, that as soon as somebody complains of retrosternal burning, some belching, burping, bloating, then they are advised PPIs. And a common preparation of DCR, that is domperidone sustained release along with the PPI. That is very common and it's become very popular. PPI along with this combination, and even the patients after using this preparation for some time, they actually ask for being for this drug to be prescribed by the doctor, not knowing what problems that they are inviting. PPI overuse not only alters the microbiota of the guts, but it has very other side effects. And the altered intestinal microbiota can be seen because of not only diet, a change in the diet. We have take a lot of fast food, saturated fats, like pizza and all these things, burgers, etc. Then we do exercise. Then the intestinal microbiota is altered. If the hygiene is not good, in immunodeficiency syndromes, hyperimmunity, and use of indiscriminate use of antibiotics, and also PPI overuse. All of these cause an altered microbiota. So the point today is we're using a lot of PPIs, and that is altering the microbiota. The other reasons which cause an the change in the microbiota I've just pointed out, but PPI is very important, very very important, and we will be seeing how it's important. Now, PPI overuse and impact on gut microbiota. The proton pump inhibitors are among the top 10 most widely used drugs in the world. Just imagine, top 10. Just go there, anywhere PPI. Every prescription has a PPI on it. And PPI is associated with increased risk of enteric infections, in particular with a 65% increase in incidence of Clostridium difficile infection. Changes in the gut microbiome can resist or promote the colonization of enteric infections. PPI use is associated with decreased bacterial richness, and a profound change in the gut microbiome. Oral bacteria and potential pathogenic bacteria are increased in the gut microbiota after PPI use. And on the population level, we see more microbial alterations in the gut associated with PPI use than with antibiotics or other drug use. Just imagine. Even antibiotics don't do the harm which the PPIs are doing. And we unknowingly prescribe more often PPIs. Now, when the microbiota changes, what happens? What are the consequences of this dysbiosis on GI tract? The proton pump inhibitors are drugs which are commonly prescribed, as I just said, for individuals who experience the acid reflux, as they are effective at reducing gastric acid secretion. There's no doubt about that. Gastric acid secretions are vital in preventing bacterial buildup, as these secretions naturally help suppress the levels of bacteria. And as PPIs interfere with these secretions, several scientific reviews have found that patients treated with PPIs often develop dysbiosis and Sibo at a much higher rate than average. PPIs have been shown in research to be a causal factor in small intestinal bacterial overgrowth. Now,
Yes.
what is the importance of stomach acid?
Hmm.
Stomach acid, and when we reduce the stomach acid, what happens? So the importance of stomach acid is it sterilizes food and the drink that we take. It breaks down protein. It activates pepsin enzyme, stimulates bile and enzyme release, protects esophagus, triggers food movement. And what are the symptoms of low stomach acid? Can cause acid reflux, body odor, undigested food, meat aversion, post meal fatigue, fullness of the stomach, but still you're feeling hungry, and chronic anemia and food sensitivities. These are the consequences of dysbiosis after the use of PPIs.
Right. So, sir, here, rightly mentioned by you and very wonderfully explained by you that PPIs are among the top, medicines that are prescribed in India today, and also that with the such commonly prescribed medication, the overuse is leading to gut dysbiosis where it affects the healthy state of the gut microflora, and it not only affects the gut microflora but it also affects the intestinal bacteria, which leads to development
Yes.
of SIBO, rightly mentioned by you, sir. So, sir, does this gut dysbiosis also have an impact on the gut brain axis? Is there any association between the gut microbiota and the brain axis? And also, does the dysbiosis have an impact to play there?
Yes, yes. I think Dr. Shweta, you have very rightly pointed out this. And I'd like to tell you one thing that although we have different systems in the body, like the GI system, the nervous system, the cardiovascular system, the skeletal-muscular system, but all of these are interconnected, and so is there a gut-brain axis. The bidirectional communication between central and enteric nervous system, linking emotional and cognitive centers of the brain with peripheral intestinal functions, and the mechanisms underlying GBA communications involve neuroimmune endocrinal mediators. This biasis occurs in functional gastrointestinal disorders that are highly associated with mood disorders and linked to a disruptive GBA. We often seen It's often seen that when the mood is when the patient is either anxious or he is depressed, there is dysbiosis and he has a lot of gastrointestinal symptoms. The main principal mechanisms of bidirectional brain gut microbiota access from microbiota to brain, the production on expression and turnover of transmitters like serotonin and GABA, and from brain to gut. There's alteration in the mucus and biofilm production, alteration in the gut mobility. You can see, you must have noted when someone is anxious, he has the gut motility increases, and he has to go loo often. No? And similarly, there's alteration in the intestinal permeability and alteration in immune functions as well. So that is the link.
Yes. So, sir, yes. So, this is something that the audience also needs to be aware of, that when they are in a stressful conditions, the motility of the gut increases, and there exists a interconnection between the gut microbiota and the brain. So, sir, talking about SIBO, and we mentioned that, the gut dysbiosis also leads to a complication of SIBO. So, sir, what are the available treatment strategies of SIBO, and what are the limitations with the existing treatment?
Yes. First of all, let's find out what is SIBO actually. SIBO is an overgrowth of more than 105 CFU per mil of bacteria in the proximal small bowel, just beyond the stomach. And changes in the intestinal pH from PPI use are thought to promote the movement and colonization of colonic bacteria into the proximal small intestine, leading to SIBO and IBS type of symptoms. The increase is particularly in types of bacteria which are not commonly found in that part of the digestive tract, and this condition is also sometimes called a blind loop syndrome. So the available treatment strategies for SIBO, once when it is diagnosed, is the use of certain drugs like rifaximin. It's a gastrointestinal selective antibiotic with a broad spectrum of microbial activity. However, SIBO can recur in up to 44% of the patients who are successfully treated with a 1 week course of rifaximin, that is 1200 milligram per day, particularly in those patients with predisposing conditions for SIBO, such as chronic proton pump inhibitor use. So it's not that if you give rifaximin, the patient is cured for certain. There is a recurrence rate is 44%, particularly in those patients who are taking continuously taking advertently or inadvertently proton pump inhibitors. So the villain for today's talk is PPIs. And symptomatic improvement has been demonstrated with tetracyclines, with fluoroquinolones, and the relapse rates following antibiotic discontinuation. There are concerns about the development of antibiotic resistance with widespread use of antimicrobial activity. And what are the alternatives? It's not only that rifaximin is the treatment, there are other ways of going through it. And when there is a high suspicion of for SIBO and risk factors and symptoms are there, then we proceed on for treatment. And first of all, we treat the underlying cause, and still the symptoms persist. Underlying cause is remove the PPS. And if the patient is anxious, then treat the anxiety. And otherwise, then give rifaximin or some different class of antibiotics and additional agents. And there is when there is low to moderate suspicion for SIBO, then you can go for a breath test. Then breath tests are available for the diagnosis of SIBO, or you can go for a jejunal aspirate. And if you see that the patient is suffering from SIBO, then go through the treatment logarithm which I just said. And the other type of treatment that are available are probiotics, which are very, very important. Prokinetics, low FODMAP diet, herbal supplementations like berberine and oregon and neem. And still the patient has these symptoms, then we can consider other alternative diagnoses and give a combination of antibiotics combined with a concurrent treatment. Probiotics are very important in the treatment for SIBO, and they are being used more often and with very good results.
Right. So, sir, exactly correctly mentioned by you, sir, that the treatment available is, antibiotics, and rifaximin is something that is being prescribed very commonly for SIBO. But there is a chance of recurrence, and there is a chance of resistance to antibiotics, which is a big concern, especially in PPI-induced SIBO. So, sir, also, you mentioned about probiotics. Now, probiotics are the alternative treatment that is available and which is considered to be a safe choice in terms of PPI-induced SIBO. So, sir, would you also like to highlight certain properties of probiotics in alleviating symptoms of SIBO?
Yes, I will go to that. But before that, I would also try to mention there are 4 R's for the treatment of SIBO. And first R is remove the bad stuff, remove that negatively, remove the things that negatively affect the GI tract, like inflammatory food, infections, gastric irritants like alcohol, caffeine, and drug, and inflammatory foods such as gluten, dairy, corn, soya, peanuts, sugar, and sometimes eggs can lead to food sensitivities. And then replace the good from the bad. You remove the bad stuff, replace with the good stuff, and essential ingredients for proper digestion and absorption that may have been depleted by diet and drugs like antacid, medications, disease, or aging, and add the digestive agents, enzymes, hydrochloric acid, and bile acids that are required for proper digestion. Then re-inoculate, remove restoring beneficial bacteria to re-establish the balance of good bacteria, and repair, providing the nutrients necessary to help the gut repair itself is important. And now about the question that you asked, how the probiotics help in alleviating the symptoms of SIBO. There are nutritional benefits, like they assist in the breakdown of indigestible foods to produce usable nutrients, promote epithelial cell homeostasis, like enhance the barrier function, promote cytoprotective responses, and improve cell survival and increase the mucin production. They modulate intestinal immune system, reduce pro-inflammatory cytokines, promote tolerogenic cytokines, and increase the secretory IG. They block the effects of pathogenic bacteria. They have a fight with the pathogenic. They are and they affect the pathogenic bacteria. They reduce the pathogen bindings, decrease the luminal pH, and also produce AMPs. So that is how they alleviate the symptoms of SIBO. And there are
Yes.
probiotics. Yes, please.
Yes. So,
Please go
sir,
ahead.
correct. Yes, yes, sir. So, wonderfully again explained by you the properties of probiotics and how each function of probiotics actually help in alleviating the symptoms of SIBO. So, this is something that is extremely important for our audience also to understand here that not only just a single property of probiotic which makes it significant to be used for SIBO, but there are multiple properties like the inhibition of pathogenic bacteria or decreasing the pH, which actually helps in inhibiting the pathogenic bacteria and alleviating symptoms of SIBO. So, sir, since we are discussing about the multiple properties of probiotics, how efficient is a multi-strain probiotic? Does it provide the benefit of individual constituent strains?
Yes. Actually, there are a lot of probiotics available, and multi-strain probiotics have an upper hand in the treatment of SIBO and also in the beneficial effects. The multi-strain probiotics exhibit enhanced benefits by combining effects of different strains. When they're different strains, they have different properties, and the properties have a cumulative effect compared to the single strain preparations. The constituent strains synergize and they have additive effects, and they result in high adhesion to the mucosa and pathogen inhibition within the digestive tract. So all of the different strains they act together, synergize, and they have an additive effect. Antimicrobial substances ranging from organic acids to bacteriocins produced are active against closely related strains. So these probiotics, which have multiple strains, multi-strain probiotics, they are better off than single strain or less number of strains in probiotics.
Mhm. Yes, sir, correctly. Again, very wonderfully explained by you, sir, that the synergistic effect of individual strains give an additive effect, and that helps in actually alleviating the symptoms in SIBO. So that is something that the audience also needs to be aware about. And so, sir, since we are discussing about SIBO and probiotics as an alternative treatment, does probiotic help to prevent SIBO-induced constipation and or SIBO-induced diarrhea? Does it have a role to play there?
Yes, certainly. Probiotics definitely help in SIBO-induced constipation and or diarrhea. There's a misconception among several patients and even medical community that probiotics are constipating. It's not so. They don't produce constipation. In fact, they alleviate constipation and they also are helpful in treating diarrhea.
Hmm.
And this is done through multiple mechanisms like modulation of the gut microbiota that we all know. We have been talking about it over the last 10-15 minutes. Then sustaining the integrity of the intestinal epithelium, upregulating anti-inflammatory cytokines and growth factors, production of short chain and branch chain fatty acids interacting with brain gut axis by regulating endocrine and neurological functions. A lot of constipated patients are because of the change in the brain and gut axis. Similarly, diarrhea can also be because of this modulated gut and brain axis. So it acts there also. And the satisfactory improvement has been found in patients with diarrhea, with predominant IBS. So definitely, yeah, probiotics they prevent SIBO-induced constipation and diarrhea.
Hmm. Hmm. Yes, so yes, sir. So this is again, something that is important for our audience also to know here that SIBO-induced constipation and SIBO-induced diarrhea, which is a common occurrence in the patients, especially which are PPI induced. So in these cases, probiotics do help in ameliorating the symptoms. And sir, since we discussed principally the treatment to be a use of antibiotics in SIBO. So can probiotics enhance the activity if added to as an adjunct, or it is added to the treatment of SIBO with antibiotics? Does it enhance the activity of antibiotics in treatment of SIBO?
Yes, certainly probiotics can enhance the effectiveness of antibiotics as demonstrated in a recent study where patients treated with rifaximin along with probiotics had greater improvement in their symptoms with dual therapy as opposed to antibiotics alone. And we have been using antibiotics along with probiotics, and this use should be encouraged, and it we actually follow this of follow the use of probiotics along with antibiotics, and we see that not only SIBO symptoms are alleviated, but the effect of antibiotics is increased.
Right, right. Yes. So, probiotics can be safely given with antibiotics to treat
Yes.
SIBO and the complications caused by SIBO. So, sir, we started the discussion with PPI induced SIBO. So, PPI being the root cause here of SIBO. So, can, sir, probiotics be used as prophylaxis, or can it be used instead of PPIs to prevent SIBO complications, or the other complications caused by overuse of PPIs?
Multi-strain probiotics containing a mixture of a lot of bacteria alleviate the indicators of IBS, including abdominal acid, abdominal ache, distress, and bloating, and improve the compositions of intestinal microbiota in the treated patients. And 82% of the patients with SIBO showed clinical improvement after treatment with probiotic containing Streptococcus. Statistically significant different favored the use of probiotics, and all the study patients completed treatment. There were no adverse events leading to treatment discontinuation. And Clostridium, also probiotics containing C. difficile in the water application of fecal microbiota transplantation, which is another effective method of treating SIBO. Fecal this thing transplantation, fecal microbiota transplantation by enema route. Clostridium species exert a lot of benefits to body health via interacting with intestine directly or indirectly, and Clostridium species could powerfully improve gut immune tolerance. And these also they also have potent probiotic characteristics for the intestinal hemostasis. Similarly, Bacillus also is very supportive, and Lactobacillus showed significant clinical improvement in 82% of the patients with SIBO. So I found that multi-strain probiotics are far, far more useful in treating SIBO symptoms. And there are a lot of patients who are complaining of alternate diarrhea, alternate constipation, and they are going through a cycle. When they have constipation, they're taking a laxative, and then they get diarrhea, and then they're taking something to prevent diarrhea, and then this is continuing for months, weeks, months, and years together, and patient suffering, and nobody is able to diagnose or treat the patient properly, and the patient is also not taking the drugs. In fact, a lot of people think that probiotics are not drugs, or they take the probiotics very lightly. The probiotics are very important, and if the microbiome of the gut is normal, then the patient is healthy. He will not be suffering from diarrhea, he will not get constipation. So, in patients who have this alternate diarrhea and constipation, probiotics, use of probiotics is should be the choice of treatment.
Yes, rightly, sir mentioned, and also that the PPI induced SIBO and PPI being the root cause of the problem here, and
Yeah.
that leading to a multiple complications does affect the gut and leads to gut dysbiosis. And in such cases, when probiotics, providing all the beneficial effects that PPIs actually cause trouble around, that is something that needs awareness around, where adding probiotics actually helps to alleviate the symptoms of PPI induced dysbiosis and the multiple complications such as SIBO. So sir, wonderful discussion, and just has been a learning experience for all of us here, where we have also come to understand what is the actual problem with PPI induced SIBO, and how SIBO leads to complications, and adding probiotics, how beneficial it is. So, sir, any clinical experience and final message that you would like to share with the audience here on how probiotics have actually helped in your clinical practice for SIBO?
Yes. I'd like to conclude by the remarks by saying that PPI use is associated with increase in pathogenic bacteria and profound changes in the gut microbiome. So the PPIs should be used very, very judiciously, and they should not be taken continuously over, say, months together or years together. That's very, very dangerous. Probiotics play an important role in treating SIBO. Promotes growth of bacteria that increase the MMC activity and short chain fatty acid production, lowering the pH of the colon and creating an inhospitable environment for pathogens and an optimal environment for good bacteria. They kill the bad bacteria and promote the good bacteria. And then the probiotics also strengthen the gut barrier function and inhibit adherence of pathogenic bacteria to the walls of the GI tract. They boost the function of the immune system and help the patient to be healthy. So these are the remarks by which I would like to conclude. And regarding the use of probiotics and my clinical practice, I found that yeah, PPIs are very dangerous, and a lot of people have been using PPIs, and particularly I am very sure about the use of this DSR preparation of PPIs, where domperidone is added to uh, proton pump inhibitors in a sustained release fashion, and the dose is also quite high. and it causes some sort of sedation and addiction to the patient. And these patients continuously take on this PPI with DSR, and they land up into problems of SIBO. So this use should be scuttled. They should be they should be avoided. And for the treatment of SIBO, one must use more often probiotics. Whenever you are using antibiotics, also probiotics should be preferred. And multi-strain probiotics are better than single-strain or few-strain probiotics. And certainly, the alleviation of symptoms with probiotics is very, very beneficial. So, with this thing, I would like to conclude. And thanks to Dr. Shweta, who has been very helpful and in conducting this talk, and she has helped me really. Thank you.
Thank you so much, sir. And it has been a wonderful experience for us also as viewers, and to understand how important it is to, have the understanding of probiotics use in PPI-induced SIBO, and how dangerous it is the going on with the overuse of PPI. So, thank you so much, sir, for taking the time out and for participating and for making us understand the importance of probiotics in PPI-induced SIBO. Thank you so much, sir.
I would also like to thank not only Dr. Gatke, but also Mr. Pratik, who has helped me in getting connected with all of you. And thank you once again. Thanks to USV, who has given me this opportunity to come in front of you and express my opinion. And thanks once again, Dr. Gatke. You are a wonderful soul and you helped me a lot. Thank you.
Thank you so
Good
much, sir.
night.
Thank you. Good night. Thank you.